I'm John Wood. I'm a licensed massage therapist here in Portland, Oregon. I practice what I call manual therapy. I'm a practitioner of myofascial release primarily, although I have a number of different tools in my tool belt that I use. Today we're just going to try to normalize some muscle movements, some myofascial areas of Kim here. And she's had some problems with pain and extra mobility in her hips and such for a long time. And my approach is fairly simple in the way we do this. And it's not like I'm necessarily chasing pain, but your body tells you exactly where the problems are as you get in and get the tissues to begin to mobilize. What happens is basically they start to become more flexible when you have a problem or a pain in wherever you're having pain. You have tissues that are stuck together. You've got lots of fine little fibers in your muscles. And as those fibers are used on a regular basis, they start to tighten up and connect with some of their other fibers around them, because maybe you're doing repetitive stress and those muscles get a little bit tired, and so they connect up together so they can bind together and do the work. Unfortunately, when that happens, and this happens an awful lot in everybody's daily activity, when that happens, those fibers that get stuck together and do that individual motion or that movement can't now do anything more individual because they're stuck together. And so what happens is, little by little, these adhesions, what I'm calling them, start to form in various areas of the muscle, making it more restricted in its movement. And little by little, as you go through the day, even without realizing it, these fibers become more and more immobile. And so what we're going to do today is just mobilize them in a very simple way. It's very basic. What I'm going to be doing is I'm going to be finding areas on Kim's body that, as I put pressure on that area, we're going to find some kind of sharpness in the area where there are adhesions. So if there's an area that doesn't have an adhesion, I'll be able to press on that. And as I press onto it, she's not going to feel an awful lot of pain because those fibers are able to move out of the way of the pressure. But the fibers that are stuck together are unable to move out of the way. And so as soon as I find them, they start to scream. And it's more like a stingy sharpness to that pressure. So we'll go through some of these areas here, and I'm just going to start on some of the tissues that are adjacent to where she's telling me that she has some problems here. We're going to start up above and down below and work our way up into that area. The reason I do that is because oftentimes when we have a pain in a certain area, we have a compensatory movement pattern on the muscles that are around that, and they begin to help that muscle that's not capable of doing what it's normally supposed to do. They start helping it, and that means that they're less efficient in the movements that they're capable of doing. So what we try to do is normalize all the movement patterns so that when there's no restrictions in those muscles, they begin to move together in an ability that the brain understands, and they begin to work together rather than fighting each other. Now, the way I approach it is, around every joint in your body, you have at least a minimum of 2 muscles that do basically the opposite things. Simply enough, you've got a bicep here, and when it contracts, it pulls your arm into this position, but as it contracts, it has to send a signal to the tricep to stretch to allow me to do that work. Now, this is one of the bases of my therapy, is that understanding that when a muscle is restricted in a certain way, it can't perform what it's supposed to do when the other muscle asks it to. So if you've got an area that's injured, say in your tricep, and it doesn't want to let go, when you bend your elbow like that and contract the bicep, the tricep can't stretch because the fibers are all locked together. And in so doing, what happens is that they become kind of an immovable object, and muscles love to contract. So when they do contract, oftentimes you don't know that there's a problem there. It's the opposing muscle that, when a muscle contracts and stays contracted, it's constantly overstretching the opposing muscle. And that opposing muscle is the one that's complaining. So whenever I work on somebody who says that they've got problems in their upper shoulders and such, yes, I go there to help ease and release the tensions that have been built up in that area there, in that overstretched muscle. But then I go to the opposing muscle, and inevitably I find some dysfunctions in that, because more often than not, in my experience, the area that is complaining to you or is painful is the area that is overstretched in that joint. And so what we're going to do is we're going to work on that area a little bit, but then I'm going to go to the opposing muscle, and we're going to find some things that are dysfunctional there. So once we normalize the movements in both of those muscles, and the normalization is a simple three-step process where I get in there, and I'll show you how this is done, but I do the pressure release, then I put a nice little formula here that I've developed that helps keep the tissues nice and flexible once they have started to release. And then after that, we stretch the tissues. Why? Because the muscle has been so locked down either in a contracted mode or it's been locked down in a stretched mode, it doesn't remember exactly how to contract well. And so what we do is we make sure that we normalize the stretch patterns afterwards, because we've already normalized the contraction patterns in the release, which I'll be showing you. So what we're looking at here right now is I'm going to do something fairly simple, and we're just going to work on a couple of areas that may be partly responsible to the problem that Kim's having up in her pelvic area here. But first of all, I'm just going to do a little bit of circular pressure work with, this is a Theracane. It's an excellent pressure tool. You can use your thumbs, fingers if you'd like, but I do an awful lot of this work, and I find that it's kind of debilitating to continue to use my fingers too much. It's important to have a sense of feel to what you're doing, but I've transferred that from my hands to this tool. I've been using it for quite a while, so I get a pretty good understanding of what's happening in the muscles. So first of all, Kim, all I want to do is just do some work on some of these adjacent muscles in here. Do you have any sharpness in any of this area here?
Yeah.
A little bit in here? Tell me where it feels like it's most sharp.
There's pretty sharp.
A little bit? Okay. So this is a lateral quadricep, and the approach to releasing this muscle is to pin that area that's sharp, because it's not able to release, and that we put pressure on it, and then I have her contract that muscle and relax it in an oscillating kind of a pumping action until she starts feeling a release in here. And how she'll initially know that there's a release is as I press on it right in here. Okay, I want you to contract this muscle, so straighten your knee. There we go. Did you feel that increase in sharpness? And then relax. The reason it increased in sharpness is we're making an area that can't even contract. We're forcing it to actually contract even harder, and so it's going to scream harder. That way you know you're on the right muscle, because if you're not on the right muscle and you contract that area, and the muscle that's in adhesed is not being contracted, you won't feel an increase in sharpness. Pretty obvious. It's not the muscle that's being used. You got that there? Okay. Now, as Kim is doing this, She's just doing it slowly and completely relaxing after she's contracted here, holding it for a couple, 3 seconds. And as soon as she starts to contract it at some point, she's going to notice, there we go, the muscle started to move a little bit less sharp now.
Yeah.
And what happens is as the muscle begins to release, it becomes less painful to do that contraction. It's becoming more normal in its contracted properties, and then relax. And at some point she's going to be able to, this isn't necessarily something that will happen in one session, depending upon how long this area has been adhesed, but the most important approach to this is a daily regimen of checking these areas and mobilizing these areas that begin to be mobilized in your initial therapy. How's that doing?
Yeah, that's better.
Better? And so this is just kind of showing you basically the approach, and what's interesting is every area that we'll be doing this is the same simple approach. And then when we're done with this, I put some of this cream on to maintain mobilization. And we're not in the right position to actually stretch this muscle, because when you stretch the quadricep, the leg has to go behind you. Unfortunately, we can't do that on the table. We're going to turn her over and we're going to have her stretch it. In fact, what I'd like to do is, just to begin with, we're going to get into this area and then we'll do the stretches later, okay? Stretches can be done within a half an hour of the releases. As long as you put some of this cream on, it keeps the tissues mobile. If you don't do anything after this for hours or even days afterwards, that area that's been released will start to go back to where it was familiar. So it's going to tighten back up into an adhesion, which is why when you do this work, you need to be pretty consistent in your daily therapy until it's gone. And then when it's gone, you check it every few days just to make sure, because what got it there in the first place may be a movement pattern that you do on a regular basis, and constantly challenges it to be able to tighten back up again. And so what we're just trying to do right now is normalize it, and then talk a little bit about what movement patterns maybe have caused this in the first place. Maybe you're not doing that anymore, but it's been stuck for a while, and now that it's not stuck, we need to unstick it, and now your movement patterns that you're doing will be able to support it rather than it fighting itself.
Yeah.
So, okay. So to begin with, though, with most of the work on the hips, I'm going to have her turn over. Okay? Let's have you turn over, facing the cradle there. Okay. Now, she's complained of some extra mobility. Sometimes that happens when a person is very, very flexible, but it's also the same situation when you aren't very flexible. What's happened is those muscles, if you are overly flexible, what happens is the ligaments are a little bit loose in a joint, and so the body recruits the muscle to actually stabilize that joint. And when it recruits the muscle, that muscle is less able to do the movements that it was meant to do, because now it's stabilizing a joint that's a little bit too loose because the ligament tissues are a little bit lax. And that happens in a lot of people. Now, when you don't have hypermobility and you're tight in an area, that means your mobility is going to be a lot less, because it's primarily the muscles that move the joint. And when the muscle isn't efficient enough in its ability to move that joint, then you're not going to be able to move that joint through your full range of motion. So again, what we're going to try to do is normalize the movements around her hip joint to make sure that she can move them correctly. And then the next most important aspect of it, after we stretch it and get it flexible, is to strengthen that area. So there is a process involved with this. Strengthening is actually the last part of the process, because if those muscles aren't capable of moving completely in their full range of motion, then you're not going to get the best out of your exercise routine, because the muscle won't be as efficient. If it's got adhesions in it, it won't be able to contract as much, and it won't be able to stretch as much. All right. So I'm going to work up just above here. There's an area just above her PSIS, the back part of her hip bone here. And I'm going to go up into what is called the QL and the paraspinals. I'm going to go ahead and find out if there's anything up here that's been compensating, and if it has, then it will probably have some adhesions that's formed because that movement is not exactly what it's supposed to do to help the hips, so it becomes locked in. Anything going on as I press into this area here? Not a lot?
No.
Okay, good. I'm right up into her paraspinals, which are muscles that attach to the skull and to the pelvis, and they arch the back. And as I go into this area here, I'm going to move up underneath the ribs. And you have another muscle in here called your quadratus lumborum, which is more a side bending muscle.
Yeah.
There we go. And then you have some muscles on the side here called your obliques, and they are more of a twisting muscle. So I've got an adhesion here. Is that sharpness right in the middle? Are we right on it?
Yeah, right
Okay.
there.
So what I'm going to have her do is find out which muscle this is. It could be a paraspinal. If so, arching her back will engage that muscle and it will contract and scream a little bit hard at her. There we go. Doesn't feel like that's hugely involved.
It's a little bit.
A little bit, okay. So let's go ahead and bend to the side. I want you to visualize, I want you to bring your arm down like this, and what you're going to do is you're going to basically crunch your ribs, there we go, down this way.
Yeah.
And there it is, right there, okay. And so what I want you to do is I want you to hold it for a second and then just relax everything, good. That allows the muscle to learn how to actually relax because it's been tightened up for a long period of time. So go ahead and find the movement that actually hurts the most, because that is the movement that is most restricted. Now, I say hurt, but it's actually a kind of a relieving pain when it's done correctly. How's that doing? Right in there, a little bit more this way. Is that it right there? Okay. And so you want to just feel where that movement actually exacerbates that sharpness, and you know that that's the movement that is most restricted in this area of the muscle. And then relax, good. How's that doing? Go ahead and do that one more time. Crunch down into it. There we go. I feel it starting to move a little bit more. Yeah,
really
feel that, and
yeah.
the sharpness starts to come down. And then one more time. Come down into it a little bit. There we go. Right there. Excellent. And then relax back down. And let's have you get maybe a 25 to 30% relief, or even a little bit more. I haven't worked with you an awful lot, so sometimes it can release really quickly. Sometimes it takes a little while, depending upon oftentimes how restricted it is.
Mm-hmm.
So was that, did you get a certain relief out of that? Oh, there we go, right there. That's excellent. I can feel that muscle engaging right there.
Yeah.
And then relax. Good. Feel like I'm still there? Yeah, oftentimes if you're pressing on it, you want to make sure that you're still on that right spot, because as you contract the muscle, depending upon how powerful it is, sometimes it can push you off of that area there. But I feel like
I'm having a hard time finding it, so I think you
yeah, I think it's probably released quite a little
yeah.
bit. Okay, and we'll put a little cream on it, and again, ultimately we're going to do some stretching in this muscle area here. Now, as I press, she won't feel quite as sharp when I get right up into that area. Better?
Mm-hmm.
Okay. Now we're getting more normal muscle movement in this area. Now, because this has probably been here for a while, this is an area that's pretty important to maintain some focus on. So she's going to do this work at home when we're done. And usually once or twice a day just to check it out. As it gets better, you don't have to do it as often, but it's always a good idea to continue to kind of check some of these areas that have been vulnerable, because they're more likely to go back to where they were comfortable, which is dysfunctional. How's all this feel down through here?
That's fine.
Good. I'm going to go to the complete lateral area here where you have some twisting muscles. Anything in here?
A little bit, but not bad.
Maybe a little bit, okay. Let's go up a little bit deeper. Not bad?
Yeah, there's...
Maybe a little bit right in there.
Yeah.
Okay. Now I'm going to go ahead and use my Theracane for this area here. And when you use it, just be gentle to begin with, but don't be afraid to go deep into the tissue, because it is, if it's mobile, all you'll feel is a poke. If it's not mobile, you'll find the adhesion, and now you know how to do the work. You can pin it. Now I would, there we go. Does that feel like that more?
Yeah.
Okay. Don't overdo it to begin with. Okay. And when you're doing this work, I know you want to help with your shoulder, but what I want you to do is only access the muscle and yourself. Don't have any other props. Well, there we go, right into it. Okay. Good. And Kim is doing this absolutely perfectly. She is contracting that muscle, finding the movement that hurts the most, and just holding it for a couple of seconds. And I'll have to tell you, even though it hurts, a lot of people tell me it hurts good. And it's because they know that this is relieving and releasing the tension in that muscle that's been there for a long, long time. And that muscle is loving this. Next time that you twist like that, I want you to crunch a little bit in that area to see.
Oh, God.
There it is right there.
Oh, yeah.
Okay. All right. And you want to make sure that you're in tune with your patient too. The key to this whole thing is I don't press too hard. She can do as much movement as she needs to increase that sharpness to begin with. So always make sure that I can back off on my pressure and you can continue to do your work as long as you're capable of getting into that movement. There we go, right in there. Mm-hmm. And then back down again. And let me know when you feel like that's released, or you even let me know when you feel it beginning to release.
Yeah, I feel it beginning to.
Yeah, because I feel that muscle starting to push on my pressure. Generally, when I'm doing this work and I press on a certain area here, as the contraction is done, I almost feel nothing. I almost feel like that area is dead, or it's asleep, as a lot of people say. And then when it starts to wake up, it starts to resist my pressure by pushing against me, because now it's starting to contract.
Yeah, I feel like it's released.
Good. Okay. And relax. And the release is palpable. The relief is palpable. It's one of those things where a lot of times we don't know just how tight an area has been for how long, because we've gotten so used to it that we didn't realize that we were holding all that tension, and then as it releases, there's just a palpable release of endorphins into the system, and just a certain pleasure of, boy, that's no longer as tight as it was, and now we can incorporate it into our movement patterns, and it's not going to cause problems with any of those movements that are related to this muscle. Of course, we have to go to some of the other muscles that are involved in those movement patterns to make sure that they're normalized, or else this will go back to where it was, because all the other muscles haven't been normalized, they're going to continue to challenge this muscle and it's going to go back to where it was. Okay? All right. Now, let's go ahead. I'm going to do the other side, and then I'm going to have you stretch it a little bit so we can show everyone how to do that. Excuse me, dude. Now, I usually start with hands because I can feel much better initially with the hands. But I've been using the Theracane for years, and I've gotten to the point where I can almost transfer that feeling into the knob of the Theracane and have quite a bit of feel for what's going on in the muscles in there. How about this right there?
Yeah.
Okay. So, yeah, come this way. Because this is on the right side, you're going to want to arch up a little bit more with your, on the right side. There we go. Find the movement that exacerbates it the most. I felt like you were almost there.
Yeah.
Okay. Now, let's make sure. Am I still on that?
Yeah.
Okay, good.
This exasperates me.
What's that?
This does the most when I go down.
That does the most. So that's mostly involved. That's the QL, and sometimes the obliques are involved with it too. Arch your back one more time. Bring it all the way up, and you notice that it's not quite so painful on that?
No, it's
okay.
not.
So there's layers of muscles in this area here, and the paraspinals and the QL actually are layered. And so if she does one movement and it doesn't increase the sharpness, that's not the movement that's restricted. So she goes to another movement on one of those other muscles, and she's found it in the QL. There we go. And then relax. Oftentimes I try to tell people to just hold it for a couple of seconds, but it hurts so good they will want to hold it for a little longer. Now, that's not necessarily a bad thing, but in this process, what we're trying to do is not only teach the muscle how to completely contract, but how to completely relax, since it hasn't been relaxed
I just
since
feel like it's released.
before this. Yeah, it feels like that muscle is moving a little bit better in there. Okay? Now, it's important to remember what movements that you did to release it, because the stretch will be a 180-degree diametrically opposed movement to stretch that specific area. Now, in a body that's not square, what is that diametrically opposed? It's a complete movement in the opposite direction. If you're this way, you're coming this way. If you're this way, you're coming this way. And we'll do more of that. But this is just something you learn in massage school. The more you understand movements of the muscles themselves, the more you'll be effective in this work. But I've also told a lot of people that if you don't really understand that, the thing that you want to do is to press into that pressure area where it's sharp. Do I find anything right up in here?
Oh, yeah, right.
A little bit right there. I'm going to use the Theracane. Tell me when it feels like I'm right on that sharpest spot.
Oh, yeah.
Right there. Okay. All right, so sometimes it's difficult to hold it this way, but just make sure you stabilize it. There we go. What movement was most painful, Kim?
Oh.
Right in there. Right there. That was it? Okay. Once you find the movement, you don't have to keep searching for it. Once you find the movement that exacerbates that, then go right to it. But as Kim is doing here, I think it's really good to be willing to just kind of move around a little bit. Find what is most intense and hold it there and then move around to release it a little bit. Good. Excellent. Now she's gently stretching it a little bit, but we'll do that, more of that later. How's that feeling?
Like it's releasing. It's amazing how fast when you work with the body in this way that it can release, honestly.
Yeah.
It's like I've never experienced any massage or anything that works as fast as this does. And actually releasing the trigger points.
Right.
It's pure magic.
And it's so simple. You just, again, be patient in what you're doing. You're going to be with your body the rest of your life.
Yeah.
So understand that this is an approach that can be done daily if you want to truly get yourself out of those painful patterns that you're constantly exposed to on a daily basis because of the adhesions that have been forming through your daily routine, your job, your play. All of this continues to stress the body and make it kind of bind up to help certain movements. And as I said, oftentimes you don't realize that that's what's causing our lack of range of motion, but we do feel pain in certain areas.
I feel like it released.
Good. It did feel to me like, again, what's fascinating about this and the experience that I have is I can't feel her pain. I can't feel how sharp that is. But what I can feel is when that muscle starts to come alive again. And it's almost exactly the moment I feel that muscle start to engage that she feels the pain go down. And that is what's fascinating about this and why I love this work, is because it is so specific to getting results. In almost everything that you do, you will find that these muscles, once they release, they begin to start moving the way they were meant to before they got injured or compromised.
Yeah, I've had a lot of body work done, massages and different things. I do yoga, I take care of myself. This actually technique has been the one technique that I say can feel like I get the most results from. It's actually working and releasing these adhesions from my body.
And that ultimately is the key to this whole thing, is that you're getting the relief. It's not, going through a lot of pain and continuing to go through pain and feeling that maybe down the road you're going to get something out of that pain. This is direct release. Okay. How about
Yeah.
Okay. Pressure okay?
Yeah.
All right. And I'm just going to go ahead and use my fingers in here, and I want you to find the movement that exacerbates that. Doesn't feel like it's more. Come this way and really bend to the side. In there at all?
Yeah.
Yeah. And sometimes it's a combination of movements. And what I find is that oftentimes if there's a connection between the paraspinals and the QL, which is a side bending muscle, and both of them hurt, both of those movements hurt, what I generally say is whatever movement hurts the most, that's the one that's most restricted, so start with that. But if you're capable and in touch enough with your body, you can do a combination of those movements like Kim is doing. She's not just bending to the side, she's arching her back and finding that movement that is specific to that whole area being most exacerbated. Feels like I'm still there, right?
Yeah, but it releases really fast. Like I just need like 3 or 4 of them.
Good.
And then they feel like, okay.
And so that's what I want you to do, is whenever it feels like you've got that, then just let me know. We'll go ahead and move to some other spots, because we have a few other areas in this area that I want to work with her. And I'll talk a little bit about, again, the importance of working on both sides of a joint. Interestingly enough, you've got superior and inferior, you've got lateral and medial, or you've got lateral to lateral, and you have a few other ones too, anterior to posterior, that are the antagonists to whatever the area is you've been working on. So in this situation here, her antagonist is over on this side. So what I'm going to do is I'm just going to have her do a very simple stretch once we are sure that all of this is pretty well released. And the way you find it is just you push into that area, and if it doesn't hurt like it did before, it's much less mellow, much more mellow, much less sharp, then you know you've gotten better movement in that area. How about right up in here?
Yeah.
Okay. And all I'm doing is just using my years of experience in finding certain areas. Sometimes I'm right, sometimes I'm wrong, but the patient will always tell you. Ooh, right up in there.
Yeah.
So let's have you just, rather than using your arms, just arch up. There we go. And there, is that? Go ahead and
It doesn't really exasperate it.
Okay, come this way a little bit.
Yeah.
Right in there.
Yeah. Oh, yeah.
Okay. And as I said, your body will tell you. Oftentimes you go a bunch of different movements and it doesn't feel like that's there, and then you do something that just fires it up, and you know that that's the movement that's this area is restricted in doing. Yeah. Good. There it is, right there. Good. It's starting to engage now. Much more than it did.
Yeah.
Good. Want to do a couple more? And I always let the patient kind of decide, because ultimately it's how they're feeling.
Yeah, it's just released.
But in most people, though, you aren't going to be able to get a complete release to begin with. So what I suggest is get a release about 20% better, okay? And this is something you're going to be working on a regular basis. So each time you do it, usually you'll get a little bit better. Sometimes the body kind of plateaus for a bit, but don't stop doing this work, because the body is preparing itself for the next movement oftentimes when it plateaus. So just keep at it and it will come along. Okay, good. And let's have you go ahead and do a simple stretch for me. Let's have you sit up. And a simple stretch for the QL and the paraspinals. Go ahead and sit and face that way. And just find something where you can stabilize one side. I'm going to have her bend over and put her elbow right here. And then she's going to reach up through the heel of her hand. Always the heel of the hand, that's what activates this area through here. And she's going to deliberately try to crunch the opposing muscle. There we go. And as she does so, and then lets go in that new position, she feels more of a stretch in that area that she worked. All right? Okay. And the other side. And then we're going to have her stretch the paraspinals, which are fairly simple also. Good. And then crunch that side. Good. And exactly, go to certain movements. Remember, you were doing some twisting, so you want to go the opposite way with that. Excellent. You feel, wherever you feel the most tight when you do that stretch is where you kind of want to hang. And when you're hanging, you're just waiting for it to become less tight. It shouldn't be painful to do the stretch, but it should be kind of tight. And then as you get into that position and you wait for it, your body, the muscle and the brain start to communicate, and the brain tells that muscle, don't restrict, don't resist it, it's going to be okay. The muscle lets go, and all of a sudden you feel that release and the relief in that stretch.
Yeah.
There we go. Now for the paraspinals, it's pretty simple too, and I'm just going to help you with this, is with the paraspinals all the way down, you want to lean over so that your head is right above your knees. Since her feet aren't on the ground, I'm going to stabilize so it doesn't feel like she's falling off. What I want you to do is bring your hands behind you. You're going to be good at this. So, but what I want you to do for me is come back, bring your hands behind you like this so that they're not involved with this. You're going to engage your abdominals here, and you're going to lean out so that your head is right above here. Now, bring yourself down by pushing in and just bring there we go. And now she's rounding her back as she does that. Sometimes you can put a little pillow or something in there, but engage your abdominals because they're the anterior muscles to your spine. And the reason you've got back problems primarily is the abdominals aren't as strong enough to support that area, and you feel the back muscles, the paraspinals, doing a lot more work than are necessary when your abdominals aren't strong. Good? Okay. Now, we're actually going to do some more work on her gluteals, which are where most of her problems are. We're going to work down into the hamstrings a little bit, but she needs to be back on her stomach when we do this. So, there we go. Now, the gluteals are one of the most abused muscles in the body because these are meant to help us ambulate, to be able to walk, but we sit on them half the day, and as we sit on them, we stretch these muscles, and as we stretch these muscles, they begin to weaken. And it amazes me how much we try to rely on these to help us walk when we've been sitting for a while. There's a number of different things that can happen to you as you get up. I know a lot of people probably experienced something in their low back that kind of was painful as they got up. Well, that's another muscle, but not quite the one that's involved with this, but it actually is the opposing muscle to our gluteals. It's called your hip flexor, the iliopsoas. Now, what I'm going to do is I'm going to find some adhesions in the gluteals here, and then I'm going to come around to the other side here because the gluteals are, go ahead and Kim, I want you to keep your leg straight, lift it up like that, and then turn your hip out. There we go. That's what this set of muscles does primarily. It's an extender and a lateral rotator. And so we're going to find this areas in here, and then she's going to do this movement. She's going to notice that, yeah, it really sharpens up if it's dysfunctional. So we'll just start with a little bit in an area that I'm pretty sure we'll find something. Right up in here. Right there. Now, I want to find to the most intense spot, the area that feels like I'm right on the center point of that sharpness. Where's that at? Do I want to go up, down a little ways?
Up, yeah,
right there,
yeah,
right there.
yeah.
I feel it now. Okay. All right, so I'm going to pin this, and Kim is going to go ahead and lift up. Do you feel a little sharpness when you do that?
Yeah,
Okay, now turn your hip out. Does that increase that sharpness?
a little bit.
A little bit? Okay, let's make sure that I stay on it. Some areas are, some tissue is so bound up, but it's kind of stringy, it's difficult to pin. So what I'm going to do is I'm going to get into it and pin it from below and going superiorly with my movement. Is that right? It right there?
Mm-hmm.
Okay. Now as I pin that, again, go ahead and lift until you find that increase in sharpness, and now turn your hip out. Go, and then back in and down. Try to do the same movement up and as you come back too, so that you're, there we go, good. And then back down. Each time, make sure that, yes, it increases that sharpness. Now, sometimes you may not be absolutely optimal. Don't worry about that. It's great to be optimal, to have that perfect movement, but if it exacerbates it quite a bit, you know that those fibers are involved in that movement and they're not helping right now. And that's why we're doing this. Good. And then back down. Felt that move better.
Yeah.
It definitely released, I could tell that. Now, sometimes we can do a few more. Each time once it starts to release, you'll notice that if you do those same movements, and you want to do the same movement to begin with, don't try to get more and more and more. Once it starts to release, then you can go deeper into that range of motion, but now the muscle knows that it can release, and now it will be more apt to release if you go deeper into that range of motion. When I say deeper into the range of motion, she lifts her leg higher, she turns her hip out further. That's more range of motion. There we go.
It's pulling on here.
And it's pulling on there? Okay.
Yeah.
So there's an involvement here between this side and this side. And when that happens, and it will happen, is what you want to do is you put a little bit of pressure on that. Tell me when it's right there.
Mm-hmm.
Yep. Well, this is an area we can work on also. As long as it's not debilitating or just kind of annoying, don't worry about this area. But I'll tell you, if you put some pressure on it and go ahead and do this movement again, you're going to notice that this isn't quite so involved in that.
Oh, yeah.
Right? Yeah. It's like almost like compression socks with older people, or whenever you have a compression sleeve or something,
Mm-hmm.
it helps with the movement, but it doesn't fix it. It just helps at that movement. I'm feeling that moving much better in there.
Yeah, me too.
Okay, good. Good. Yeah. Initially, I felt almost no movement in there. Now it's pushing me away both with elevation, extension behind you, and turning it out. Okay? All right. And I'll put a little bit of cream on that area. As I said, this is really helpful in maintaining mobility, and it has some incredible healing ingredients in it to help hasten the healing of the fibers that, even though we've broken them apart, they've gotten a little bit torn. That just happens with this kind of process, but they get healed much more quickly now that they're moving, and because of the cream. So I'm going to go to a couple more spots here that could possibly be involved with it. Go deep into this area here. Tell me when. Yeah, right in. How's this right in through here?
Yeah.
Right in there? Okay. Again, where is it most sharp? Right there, and movement that increased it. And then turn it, there we go. That increase it also? Not so much?
A little bit.
A little bit? Okay. Let's make sure that I'm right on that. If you want to be efficient, if you're going to do this work, you might as well make sure that's
Yeah.
there. Okay. All right. And you're going to find this also, some areas that are sharp, and you think, oh, okay, but then you move it around a little bit, and all of a sudden, boy, it just nails you. That's where you want to be. That better there? We're more focused in on
Mm-hmm.
it? Good. Now she's turning her hip in and out because honestly, sometimes some of these fibers are just stuck together, and she's doing a little bit of movement back and forth, and that helps to release those fibers from each other. How's this doing over here?
It's flaring it up.
It's flaring up again, yes. So this is the next area that I'm going to go to, because your body's telling you that this is involved in this movement, or else it wouldn't be doing that. She's probably stabilizing a little bit more on this side, but again, this muscle's incapable of doing it without some pain, so we need to find what's going on there and get it normalized again. How's this over here?
Much better.
Much better, right? And turn that out completely. There we go. Good. And then back down. Okay. Oops. Now there actually may be a few more adhesions in this area here, but that's why you just check it out on a daily basis. And what we're going to do though is it feels like those were the primary ones. There might be some others. We can always work on that. Before I go over this other side though, since I'm over here, I'm going to check the opposing muscle to these gluteals, which are muscle called your actually gluteus minimus and TFL, tensor fasciae latae. And those muscles turn her knee in, her hip in, and they help with the iliopsoas to flex that joint, flex it forward. So what I'm going to have her do is, as I check these areas here, let me know, is there anything here that feels like it's exceptionally?
Not yet.
Yeah, good. Let's go ahead and I'm going to go in a little further. Okay. Good. If none of this is exceptionally sensitive,
Oh yeah. There's something.
right in here?
Yeah.
Okay. Sometimes if an area has been stuck for a long time, initial pressure, it almost feels like there's nothing there. But as I press and move around in this area, what we'll do is the fibers will start to wake up, the pain receptors will start to wake up, and all of a sudden, instead of kind of a numbness or not feeling much there, all of a sudden it starts to flare up into some sharpness. Is that it right there? Right?
Mm-hmm.
Right in here?
Right here.
Ah, okay. And then as I press on that, there,
Yeah.
okay. Let's go ahead and have you turn your hip in towards the middle of your body. Right there. And back. Did that increase that sharpness a bit?
A little bit.
A little bit. I want you to turn it in this time and now press your thigh down into the tape. Oops, yeah, that was part of it right there. Let's have you bend like this so that when you do press down, you won't be pressing with your lower leg, you'll just press with the thigh. Go ahead and press down into it. And there, and relax. And again. Have you got some release already in this?
A little bit, but I think.
A little bit, but it feels like it's right in there. Ah, a little further in. How about right up in? Feeling it there.
Maybe I did get released.
Yeah, it's very possible that. Okay, good. Now I'm going to check another muscle that is a medial rotator, and it's your adductors. Basically, I'm going to come up into the inside of her legs and check to see if there's any sharpness in any of these areas. Anything going on there?
Mm-hmm.
Okay, we'll work with this again, but I'm going to go ahead and work on this other side. Oftentimes, you have a medial rotator on the opposing side, but you also have some helpers down here. You've got the adductors that pull the legs together and actually kind of help turn that knee in a little bit. And so those could be involved in helping this gluteal maintain dysfunction. And so what you want to do is, again, just find all the areas that have got the sharpness, normalize the movements, get rid of the sharpness, and you're going to notice that now I move better and it doesn't feel painful to move that way. All right, let's go to the other side here. Excuse me. Okay. Now we go right to that area that you felt was initially most painful. Feels like we got something going on right in there.
Yeah, but it's around that area. But
Okay. Doesn't feel like it's quite there.
yeah.
Okay. There's something right up in
Yeah.
here too. As I press on that, is it kind of flaring up a little bit?
Yeah.
Yeah. And this was what I was talking about. Some of these areas that have been super, super tight, they won't respond to the initial pressure. So I just kind of move around, do a little massage until I find the exact area. Right? Why don't you tell me when it feels like I'm right on that? Or if you need to guide me a little bit down and through here. Okay.
Yeah.
All right. How about there?
Yeah.
Okay. I'm going to go ahead and stabilize that area, and again I'm going to have Kim lift her leg behind her, turn it out. Right there, it feels like that's involved.
Yeah.
Yep.
Oh.
Okay. And then back. Good. And I've got a good amount of pressure on here, but it's not hurting any of the tissues that are not adhesed. But what it is it's forcing those tissues that are adhesed to start to break up. And you want to contract the muscle, not stretch it under this pressure, because as you contract it, those fibers come together and don't actually tear nearly as much as if you were to stretch it underneath this, and which would tear the fibers away. There we go. Good. You're going a little bit higher on that. Good. Now it's move me around to tell me when I'm right there. There we go. Right there. Okay. And this is why this can be done yourself, because you know exactly where all of your sharp spots are. And I have a good idea, but sometimes I have to be directed to exactly where it's most intense. There we go. Good. And then back down again. Right there.
Mm-hmm.
Yep. So I found this muscle here, and again I'm going to go below it and come up into it to pin it, and she's going to go ahead and do the movement. There we go. And back. Now there is a little bit more movement involved with this. You can actually swing your leg out just a little bit, because we're on the lateral aspect of her gluteals here, and as she does those movements, maybe that exacerbates that.
Oh, that is.
Right in there? Okay, so we have some fibers here that actually respond. There we go. She's stretching them a little bit underneath this. I want to have you come this way, Kim. Let's go ahead and bring it all the way out this way. How about that? Okay. That's contracting them more underneath this rather than stretching them. Ultimately, you can do that if you don't put too much pressure. That will help release them somewhat by stretching them underneath minor pressure. But you still have a little bit more tearage in the tissue when you are stretching it underneath that pressure. How's that? Looks like it feels like you're moving quite a little bit in there.
Mm-hmm.
Now, let me make sure I'm right on that again. Right there?
Yeah.
Okay. So find that movement in this area here that really exacerbates it, and tell me where that's at. Which of those movements is most intense, right? There?
Yeah.
Okay. So I want you to just hold that there and then go back to neutral again and then back down and completely relax it. Again, this is the part that's really important, even though oftentimes, well, why? Because this muscle is not relaxed for a long period of time, and we need to get it to learn as much to relax as to contract correctly. So go ahead, again, lift up right to that point, bring it out. Good, turn that hip out a little bit more maybe. That's turning it in a little bit, turn it out. Good. Feel like you're right on it there? Great. Sometimes, and what I'm noticing with Kim is she's so focused in on this that she isn't totally communicating what's going on, but I know that she's finding the right spots because I can tell as she's doing this that she kind of orients to a certain movement pattern, and that's the one that is most restricted. There we go. It's starting to move better now. And look at what you're doing. Look at how much more movement you have or are willing to do now that those fibers are starting to free up. Okay? Good. That just popped me away. How are you doing?
Good.
Much better? Awesome. And that, like I said, that's really the key to this whole therapy, is that you get such immediate results with this kind of work. It's just fascinating and how effective that can be.
There.
So right in there. Okay. All right. Okay. Okay. Great. We have her husband here also, who's helping with the videos here. His name's David. Heard him coughing a little bit there.
Oh yeah.
Right in there. Okay. And again, just feel like I'm right. I want to be right on that center point.
Yep.
Right there. Okay. And as I pin that, I want you to find the movement. Now, be very specific this time, because I kind of want to show specifically how to do some of these movements for some of the people who are watching. Just bring it up until you feel a little bit of increase there. Okay. Now, just turn that hip out. Good. You'll notice it increases even a little bit more there.
Yeah.
Okay. And then back in and down. So again, just hold it for, again, you can hold it for up to 3 or 4 seconds. That's not a big deal. But when she comes back down, the key to it is to get completely relaxed. Just let the gluteals completely soften. There we go. Good. Felt like we got some movement already in that. Good. Okay. And again. Go ahead and swing that out a little bit too next time. Great. Now, did that increase that sharpness much when you went all the way up?
No, it actually didn't, because it's releasing already. I can feel it. Like,
Now, there's also a point where when you go through that range of motion, you feel that sharpness, and then as you move beyond it, it goes away. Well, that indicates that that part of that range of motion actually isn't restricted. And so what I generally do is just have my patients go to that area that's most painful, because that's the area that needs to be restricted, released, and is most restricted. There we go. There we go, right there.
Yeah.
Well done. And then back down again. Good. And again, not all of you are going to have that range of motion that she has, but even then, look, with her range of motion, she still has some adhesions. So it's not just people who are super tight. There are people who have good range of motion who still need this work to get optimal movement in those muscles, in those areas that are adhesed. Okay, so again, we'll put a little cream on that area. And again, I'm going to go a little bit more to the side this time too, because you have muscles that, okay. You have muscles that abduct the leg and bring it straight out like that, and they're located right on the side in here. So those are the ones that are mostly involved with just bringing the leg out like that. And then, like I said, you have more muscles that are in front. You felt something right there? Okay, that's what I was thinking, that we might have a little bit of that going on through here too.
Right here.
Right there? Okay. Go ahead and relax. Let me get in there. And again, just identify.
Yeah.
There it is. All right, so being where this is lateral, she's still going to have a little bit of hip rotation that's going on with this muscle, but a lot of it will be just abducting or bringing her leg out. And I want you to go ahead.
Cut off of it a little bit.
I'm going to go right up into it. This is pretty deep right in through here, right there. All right. Yep, lift it up a little bit. There we go.
Oh, God.
Swing it out. There we go. So it has a little bit of extension involved with this set because it's screaming at her. And then go back. Yeah, just give it a chance to relax in between. Good. And then when you're ready, are still there?
Yes.
All right. I can kind of tell. Go ahead. There you go. Good. I feel that start to engage it. Good. Nice. Now what she's doing is, because she's capable of doing this, and I don't totally recommend this for everybody, is she's able to get almost immediate release, and so she's pushing deeper into a range of motion to find out if there's more adhesions further into that range of motion. What I suggest though is you do that initial movement, get that to release before you start to. And oftentimes it'll take a lot longer than what's happening with her, because as I said, she's very mobile, she's flexible, got a lot of strength in her muscles, but there's still a number of areas that are adhesed that are preventing her from getting the kind of movement that her body can do. And then back. Go ahead. Right. So what she's experiencing here is a pain that is so good, she wants to stay in it.
It's true.
It's true. And like I said, it's all part of this process. You're going to notice that this is not the kind of pain that you want to avoid. It's actually the kind of pain that you gravitate towards because, okay, a little bit in there, okay. You want to gravitate towards because it is a relieving type of sensation rather than something that is uncontrolled and flares up at a moment's notice and something you can't control. And by doing this work, you're going to keep the muscle from doing that because it will not have the ability to flare up once it's starting to normalize its movements. Okay. And then back. Good. Starting to move more. Now, if this doesn't release completely right away, okay, here in the next couple, 3 movements, this will be an area that you'll want to pay attention to in the next few days. Just take your Theracane and get into these areas. When you do this work on yourself, you know exactly where your problems are. With me, I kind of have to hunt and poke a little bit. I have a good idea where a lot of this is at from many years of experience, but each and every one of us is slightly different in our dysfunctions, so to speak. How's that doing? It feels like that's
so much
moving.
better,
So
yeah.
much better, yeah. Excellent. Good. Got a little bit more there.
Yeah.
Okay. And then back down again. And then you come back up to that same area. I want to make sure I'm right in there.
Oh, yeah.
Okay. So this has been this way for a while for Kim. And,
Yeah.
and so it's going to take a little bit to release it. She's getting relief from it, but there's still a lot of these areas, the deeper areas, still need some release. Good.
Oh, yeah.
Okay. I'm going to go ahead and we're going to stop right there. We're going to go to the other side here too. I think what I want to do is go to the front part just to check that out. Then I'm going to have her do stretches for this entire area through here. We've already stretched the upper, above her pelvic area here with the 2 stretches you saw before. Now we're going to do some stretches for this area through here and through this area through here, since she had some stuff going on in that medial rotator on that other side. Let's check to see what we've got over here. Feel like I'm close to anything through here?
Not yet.
Not too bad, okay. I'm gonna come up into this area then. Feels like that's, how's that in there? Not too bad. Good. This is just close to the area we just worked. Okay.
I think it might be down more.
I'm not finding a lot in here, so I get the feeling
Right here.
that some of this, there we go, go ahead. Right in there.
Yeah.
Okay.
Yep, right there.
All right, so I'm going to pin this.
Ah ha 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 ha.
And now I want you to slowly move, because I got my thumb here, and I don't want you to pin it. What I want you to do is turn your hip in a little bit. So just turn the knee in the other way, other way. There we go, right
Oh,
in,
God.
there it is, right there. Good. And then relax it. Okay. I've got my thumb supported by my other fingers here as she's doing her move. Ooh, right there. There we go. And as you turn in next time, I want you to press your thigh down. So bend your knee so that you're...
Ah.
Okay. That's what's going on. So again, try to bring it up like... Oh, there we go. I don't think I got into it right there. Okay, we've got some stuff going on right there.
Yeah.
It's a little bit more difficult to pin where we're at,
Yeah.
right? Good. Okay. I will almost guarantee that you're going to find it easier to find these spots here. Okay.
Lost it.
Okay. I'm not going to worry too much about that. We can do this from the other side also. I can have you turn over and work on this. It'll be easier for us to do that. Okay. Right in there?
Yeah.
That's good. Right in there?
Right here.
Right there. Okay. And with Kim, her areas are so specific, it's sometimes difficult to find, but I guarantee most people will have a larger area to find and be much easier to find these adhesions. Right up and through here. Right, yeah,
Yeah.
right in there.
Yeah, right there.
Okay, now just relax. Okay. I would suggest that if you have an area that's really, really painful, that all you do is put pressure on it. Get it to scream at you, but don't do any movements and wait for it to release. When it releases, you're going to notice that screaming won't be quite so intense. At some point, you can go a little bit deeper and it will come back up and be fairly sharp, but that will release too. And after you've been doing this for a little while, you'll notice that you're much less sensitive to this pressure work, and then you can begin the movement under the pressure. But I suggest just putting pressure. That's what these Theracanes are about. They tell you to just put pressure on an area, on your shoulders or whatever, and just hold it, which is effective, but it's not quite as effective as retraining the muscle to contract and then getting it to stretch afterwards. All right, so let's go ahead on this. I'm going to have you turn over. We're going to do some stretching here. Yeah, I want to make sure that we've got, we don't spend too much time on this. How, David, how much time have we been doing on this?
Hour and 20-ish.
Is already? Okay.
Yeah,
It's
pretty video.
simple to do. Let's go ahead and, so she's actually stretching some of these areas of her gluteals when she's doing this, but there's an actual easier, more simple way. Let's have you turn over onto your back and put this underneath there. Now, stretching the gluteals, fairly simple. You just put it like this, and she can bring it up as high as she wants to, bring it up this way. She'll feel more of that stretch on the upper part of her gluteals when she brings the knee as high as you can. But just bringing it up and across. Remember, her movement was behind and to the outside, so her stretch will be bending and to the inside, and voila, there's the stretch right there. And then she's just waiting for it to release, and the body's just right now, that it's kind of traumatized. It's going, I don't know if I want to release. This is really weird territory I'm in right now. But the brain has complete knowledge of the capabilities of that muscle, and as soon as the muscle starts to trust the brain, when it says, yeah, you can do it, you can relax, then it does. Yeah, okay. And let's go ahead and do the other side. And one other thing that you're doing before we finish here is that the stretch is not just to get mobility in that muscle. Where do you feel it? Right in there? Okay, so you've got a little bit of compaction going on in there, and what you want to do is, again, wherever she's feeling a little bit of discomfort, she finds that area, makes some pressure into that area, moves it a little bit. Once it releases, she can do this without any discomfort in that area. But again, this is just for the moment, and you want to continue to do this work on a daily basis. But what I was saying is the other part of the stretch is, as you do the stretch, you tune in to where does it feel like it's not stretching, because there may be more adhesions in that area, and when you tune into it, does that feel like right there? Okay, so let's do this very simply. Let's find it. And this is one of her kind of medial rotators, but it's her hip flexor here, right in there. There. Getting close.
Yeah.
Right in there.
Oh, yeah.
Yeah, I felt that. Right in there.
Uh-huh.
All right, so I want you to just lift your leg up towards it. Oh, yeah. And do it again. There we go. Bring it up. Good. Where it's most intense, I want you to stop. Okay, right there. Good. Right there. Right right there. And then relax back down. And then I want you to do that again. Good. Turn your hip in a little bit there. Does that increase it?
A little bit.
Just a little bit? Okay. That's part of the movement then. As I do this, go ahead and turn it out. I don't think
My
it's gonna...
hips popping. Do you feel that?
No, I didn't, but yeah, I'm not at all surprised. And what popping is, especially if it's not painful, is that the soft tissues are releasing from the different muscles in the layers are releasing from each other, so that they can move more freely, independently of the other muscle they've been stuck to. Yeah. Good. How's that doing?
Oh, good. So
Good.
much better. Yeah.
Okay, now let's go ahead and do that stretch again. I'm going to put a little cream on it. And ultimately, you might want to stretch this area too, which would be behind you
Yeah.
and that way, okay? Go ahead and bring it up.
Yeah, it's tight.
Right where? Right?
Like all in here.
Right in here,
Yeah.
okay. So we've definitely got some restriction in this area there, right in there.
Yeah.
Okay, so where she's pointing it's another hip flexor muscle. It's your rectus femoris, and what it is it's one of your quad muscles is a hip flexor. And so I want you to actually straighten and now lift. Is that it right in here? Not much. Getting into a more lateral area. Ah, right there. I can feel what you're talking about right there. This is more a lateral quad, so I want you to straighten your knee and turn it out. And back down. Ah, we're getting down into the IT band. Now, the IT band, as you'll notice from this, the IT band is attached to the glute max, it's attached to the TFL, it's attached to basically this glute medius in here and the minimus underneath it. So that's an area that you need to keep working, because you'll see from here, this white area is tissue that does not stretch. So if you do any work on this, you're not really going to get anything done. These are the areas that need to be released, which is what we're working on. And once those release, this will become less tense through here.
Yeah.
Okay? So, anything going on through here?
Yeah.
Let's have you do the movement so I can get an idea. Let's know. Bring it up to where it was painful. You bend it. Okay, bring it up. Bring it across.
Oh.
Where is it? Right there, huh?
Yeah.
Okay. So I want you now turn your hip into it. Does that increase it?
Yeah, but in a good way.
Yeah. But again, increasing it means you're doing the right movement. So get into it like that and then relax it. So put your foot right there and then come back into it, turn into it. There we go. Does that increase it right there? A little bit. Do I need to go down a little ways into that? Okay. That feels like that's moving better. I'm going to go up into it.
Oh, yeah.
Yeah, right there. So that feels like that's not moving quite as much.
Yeah.
And so, and this is where I was talking about earlier, is if you don't necessarily know the movement of it, just push into it. And as you push into it, it will make that muscle contract. Good. Tell me when that's feeling better. Turn it out, into it, there we go, back and forth. How's that doing? Better?
Yeah, a little bit.
A A little bit. So you've got some stuff.
Long
You've got
time.
some stuff going on that we'll
Yeah.
we'll go through more. But how about right up in here? A little bit. Okay, we come into it. Yeah. And then relax. Just go ahead and straighten your. There we go. There. You feel that? Okay, and then relax. And then straighten it. This is a quad, that's why she's straightening her knee to contract it. Okay, yeah, let's have you come back out.
Ah, God.
Still right in here?
Yeah, it's like, oh, that's right in here. It's
Okay.
really tight.
All right. So we're definitely finding where a lot of this is manifest. But as you do this, does it start to release it all?
Yeah, yes.
Starting to a little
It's
bit.
starting to a little bit.
Yeah, so you're stretching it, starting to release a little bit.
Yeah. That's the most I've been able to stretch it for forever, though. This is.
Well, like I
Wow.
said, a lot of this work will just take, daily attention, but will make
Whoa.
a lot of difference.
Yeah.
And like I said, now that we've identified that, we want to always check those other areas that we've been treating here, and make sure that they stay just feeling like a poke when you get into it.
So doing it on myself, I can just push and then.
You can just take a Theracane. You can get in there and you can do that. Now, oftentimes, you've got, you don't have a lot of extra fat on you, so it's not easy to pin an area there and just have the tissue around it kind of cup it. So we kind of have to get in there and move that tissue a little bit.
Oh my God, it feels so much better though already. Wow.
We've got,
My
Good
range of
release.
motion is.
and what
already
she's
better.
doing also, she's checking to see where it's still tight in this area here, which would be probably some other adhesions. And so if you're doing that stretch and you feel a tightness in a certain area, take your Theracane, get in there, work on that, press on it, and then do the opposing movement, get that to release, and then do your stretch again, and voila.
Wow, that's significantly better. I mean, I'll continue to work on it, but
Yeah,
like
I know.
it was super painful to even do that. No, it's not
That's
like
awesome.
that. Yeah.
Okay. Well, I think
Wow.
that's good for today, right? So
Yeah.
I appreciate you guys coming in here and getting this started. Oh,
You
by
want
the
to just
way.
talk a little bit about that for
Yeah.
a moment?
So what I do is I've got this proprietary formula of incredible organic herbs and MSM, aloe vera, a whole bunch of other awesome healing herbs, and this is what I put on the muscle areas right there to help that tissue to not only the pain go away, but it actually heals that tissue. And so
Yeah, my friend Lisa turned me on to it.
there we go. Awesome.
And
Thanks.
she said she had some